I'm a family doctor. I started working with drug addicts in the Algarve, the south of Portugal.
I retired as a detective lieutenant from the New Jersey State Police after a 26-year career there. And for 14 of those years, I worked undercover in narcotics.
With the democratic revolution, with the association of these new things to the idea of freedom, there's a huge spread of experimentation. It was not a problem connected to marginalized people, but it happened with everybody. So medium class, high classes, people started to say, my son is not a criminal, he's someone who needs help. In my view, this was the field where the idea of decriminalizing grew. And even the Catholic Church supported this idea.
When I started working undercover, it was 1970. That was the beginning of the war on drugs. And rather than try to help people who were abusing drugs, we decided we were going to criminalize this, and we were going to do everything we could do to destroy their lives, and boy, did we ever do it. We worked on the idea of like the film Reefer Madness, Man with a Golden Arm. We treated these people like they were some sort of demonic monsters. The police were told back then that these people would just as soon kill you as look at you. So when we hit the streets, we felt that these were the worst people we would ever be dealing with, and we treated them as you would treat somebody who was like that.
It's still prohibited to use drugs in Portugal. People can incur in penalties, but not in jail penalties, not in a criminal record for life. It's only an administrative sanction, and which aims to address people to the adequate responses in society, either treatment facilities or other kind of social responses that they may need.
Back then, mere handing of one marijuana cigarette from one person to another, if that person receiving it happened to be an undercover agent like me, got those people sent to prison for 7 years. Something that we know from statistics, that the people doing that, within 5 years, almost all of them will just put the drugs behind them. Say, enough of this, let me get on with my life. You can do that if you haven't been arrested, but once you're arrested, especially if you're poor, you can no longer get on welfare, you can't get food stamps, you can't get the WIC program, which is to help you feed infants. You can't, they try to take your driver's license away, and in most cases they succeed.
And they try to understand if they are dealing with an addict or with someone who is just a recreational or occasional user. If he is an addict, he's invited to join a treatment facility. And everything is facilitated, like a red carpet. If you want, you need help, you need treatment tomorrow. At 10 o'clock you will meet Dr. X and he's waiting for you. Everything is facilitated. And in fact, it is very effective. They can just refuse it and nothing happens at the moment, in the first contact with the commission. But the file, there's a file, it's not a criminal record, I insist. The file remains open, let's say during 6 months, for instance. If during that period there's no new episode, if the person does not come to the commission again, at the end of that time it just disappears with no trace. If during that period the citizen shows again, then he can incur in some kind of penalties. For drug addicts, never a fine. Your choice is still using drugs. Even so, we don't give up from people, and we join them with the harm reduction policies, syringe and needle exchange, trying to evaluate them, to screen them for infectious diseases, even using the address to hospitals.
Now, there's some other countries where they treat drug abuse as a health problem. And when you do that, you have a much better situation. It's better for the people abusing drugs, and it's certainly better for the communities and their families, and even better for law enforcement, because law enforcement's not wasting all this money chasing these people around.
Drug addiction has dramatically decreased. We had a big festival last weekend, the Rock in Rio in Portugal. I'm sure lots of people use drugs there. It doesn't mean that all that people that use drugs there are problematic drug users.
We don't believe that drug abuse is the mere act of somebody using what is today considered an illicit drug. But that's what has been going on for 44 years since we started the war on drugs. The mere using of one of these drugs makes you a criminal.
We had a slight increase from 2001 to 2007, and now a decrease of prevalence of every drug since 2007 to 2012. People don't fear to approach the health system or the social system. It was an enormous decrease in the numbers of AIDS infection among drug users. The number of people under treatment raised during the last decade, the last 13 years. And the problem that was the first concern of the Portuguese people when we started is now at the 13th or 14th place in the ranking.
What we have to do is we have to treat these people like they're someone with a health problem when they have a problem. And what we at LEAP feel is a problem is when the person themselves says, gee, I've got a problem with drugs. And at that point, they are abusing drugs. And at that point, we should do everything we can possibly do to help these people, not do everything we can do to remove all hope they have for the future.
What was really important is to make treatment available for everyone who wants to treat themselves, for free, easily accessible, okay? Open doors with no constraints, active search of most disorganized people in trying to invite them to join the health system. It's a complete package of policies that are sticked together by this idea of decriminalizing, of looking at drug addiction as a disease like the others, like diabetes or hypertension or whatever, a chronic relapsing disease. Portugal went as far as possible within the prohibitionist paradigm. But now it's the time to others to take the lead. We are watching with enormous interest to follow what is going to happen with the new legalizing paradigm.